Hi, everyone. My name is Selena Belisle, and I am the founder and one of the board approved CE providers who teaches CE classes here at CE Institute. We primarily teach to nurses, massage therapists, cosmetologists. However, we also have acupuncturist, occupational, and physical therapist in our class, and more. The trending theme here is you should be some form of licensed healthcare provider to take our training or follow along because you need to rule out things such as contraindications and precautions prior to working on people, prior to soft tissue applications, because we want you to do no harm. And we need you to employ that rudimentary practice prior to trying to apply some more advanced skills like what we teach at our school. Today, I want to show you how we work on plantar fasciitis, specifically chronic scar tissue developing from plantar fasciitis. You would never practice this technique on somebody who has a new acute, fresh, swollen tear. Okay. Pressing into freshly torn tissue is probably only going to further tear it. Now, it's only going to be micro tears. That plantar fascia is quite thick, but we don't want any tearing. Minimal tearing with our body work, okay? And pressing into torn tissue, it's just contraindicated. You shouldn't do it. Now, people who have torn plantar fasciitis will, yeah, I mean, it's swollen, it's torn, they're in severe pain. They'll do anything to get rid of it. Unfortunately, time, rest, ice, those are the ways that acute plantar fasciitis is usually treated. However, once that tear has healed, it scars, okay? And there's a lot of collagenous, dense scar tissue in there. We need to break down that scar tissue so that they can resume full function. It's less restrictive and less likely to tear. The number one reason for plantar fasciitis is usually previous tears. What happens is the scarred area, it's healed, but the area adjacent to it usually tears because it's weak above the scar tissue. So we want to break down that scar tissue, and we have very unique skills on how to do it. Let me show you how we work on plantar fasciitis scar tissue after it's healed. Now we're going to work the plantar fascia in the pronated position. We're going to flex the knee to 90 degrees. And I'm going to put this on pause for a moment because I want you to see. I have just retracted the toes. So I've pushed the toes and the entire ankle into a flexed position. Okay. This guy is pretty immobile. This is about as far as his foot is going to dorsiflex. Okay. As I pull my fingertips inferiorly back towards the client's calcaneus through the digital slips, parallel to the digital slips of the plantar fascia, what's going to happen is I'm going to try and further push the client's foot into dorsiflexion. And then when I get back to the calcaneus and when I release and come back, I'm going to allow that foot to plantar flex. And it looks like this. Ready? So I'm pulling back. And then you see me plantar flex a foot. And that's just releasing that ligament, the stretch on it real quick. And then we go back to stretching the ligament by retracting the toes and pulling inferiorly, stretching that fascia. Now I'm inverting and everting the foot. I'll put it on pause for a second. You have a better view on the right hand screen here. So when the toes move inward medially, I'm moving my hand laterally. And then when I bring the toes out laterally, I'm going to move my hand in medially. I'm doing this right in superior in front of the calcaneus, about a third of the way up the foot. That's where the plantar fascia usually tears, so it's a great place to work and try and thin that fascia, break up any scar tissue in that area with that inversion, eversion, cross fiber friction on the plantar fascia itself. So on the right-hand side, you have a better view of the footwork here, and you can really see me pulling back with my fingertips through the plantar fascia, through those digital slips where they join to one larger, thicker ligament right here, right in front of that calcaneus. And now I'm cross fiber frictioning with an inversion, eversion of the foot to try and break down any scar tissue. And you can alternate back and forth from pulling inferiorly to cross fiber frictioning.